Speaking as a clinical midwife manager, how much of your day is spent on documentation?
A lot of the day is spent on documentation as a midwife manager, because at the end of the day, if it's not written down, it's not done. However, over the years, a lot of our time as midwives and nurses is more focused on documentations because of the medical legal aspect associated with the job. And unfortunately, sometimes it's a culture that you can see coming in that the nurse and midwife is spending more time with the documentation and less time with the patient.
Do you think there's a need for this large amount of documentation?
Yes, there is certainly a need for the documentation because of the medical legal aspect and also for accuracy in notes, but sometimes, and I hope not, but it can be at the cost of the patient.
And do you think there's enough time spent by the patient's bedside?
No, not always, and sometimes you have to roll it right back. Over the years I've seen a huge change in the amount of documentation we do, but you have to bring it back. The newer and younger midwives and nurses are very focused on their documentation, and sometimes you really have to bring them right back to the care of the patient. The priority is always the care of the patient.
And do you think this paper can sometimes distract you from caring for the patient holistically?
Sometimes holistically. In midwifery, certainly it's a holistic approach to the woman and to the child and to the family. But yes, the documentation can take you away sometimes from the mother, but at the same time you are working as a unit in the sense that you are adhering to her birth plan and her birth wishes.
Okay, and do you think we as nurses spend too much time developing our interpersonal relationships between team members and less time developing relationships with patients?
No, I wouldn't fully agree with that. It's very important that there is a good interpersonal and development between all spectres of the workforce, between the attendant, the care assistant, the staff nurse, the staff midwife, the manager, the CMM3 and the directors of nursing and midwifery. But I don't think really it does interfere with the connection with the patient.
Okay, and from your experience of nursing, have you ever made a documentation error?
Honest to God, I've never made a documentation error, and sometimes cases are brought before us that we would have to, that you mightn't remember the case, and you might be asked for if the case was going to court, or if there was an internal inquiry involved in the case, your chart would be presented to you, and you would only be relying wholly and solely on your records at the time, because you couldn't possibly remember everybody over a 22 years of experience.
Do you think nurses can prevent documentation errors occurring?
Yes, we can, but given the workload and the shortage of, and the chronic shortage of nurses and midwives in Ireland, it can be very hard to document everything without losing focus of the patient. And yes, errors are made and they're human errors, but I think it's very important that people reflect back on board alternate guidelines, at least attend a study day on documentation once every 2 to 5 years. I recently did one and it was outstanding, and I think that one-to-one preceptorship from a midwife to a student midwife is an excellent way for a student to learn on accurate documentation.
And finally, what do you think are the most important aspects of nursing?
The most important aspects of nursing are, of course, looking after your patient as a holistic person, and also looking after the family as group. As a midwife, we tend to steer into the meeting each individual's needs, what their birth plan is, what their choices for labour are, what their expectations and what their outcomes that they would like to see come true, and to be taken on that journey. But at the end of the day, your responsibility is to your patient, and that has not changed over the years. Things change, but the patient is always number one.
Okay, thank you.
Thank you.